Wonderful. All right, welcome everyone. I'm Sophie Alexander, owner and lead practitioner of the Nutritional Wellness Center, and I'm excited today to talk to you about pulsed electromagnetic field therapy and how it reduces stress and helps restore the body. Oh, let me see if I can forward my slides. There we go. So everyone who's currently on this Zoom talk knows me well, so I'm not going to go into a lot of detail about my background, but I'll leave this screen up for just for a moment for anyone who's watching the recording and doesn't know me, doesn't know my story, and why I'm passionate about nutrition and about sharing information that helps people be empowered about their health. But yes, I have been doing this work on my own personal body for getting on for 13 years. And, this slide shares my original reasons, for the history of Lyme and digestive issues about why I got into this work. But as I get older, as I've had children, things like that, it just continues. I continue to learn and continue to be amazed how important this information is and how it can impact such a diversity of health concerns. And also how we need adjunct therapies too, as well, to the nutrition foundations that we apply. And that's part of why this talk today. So this talk is lecture number 2 in our Optimized Mitochondria Function Zoom lecture series. And it's all about the pulsed electromagnetic field therapy. But you might be hearing more and more about mitochondria. I feel like it's really a key piece about wellness. And so before I talk more about the pulsed electromagnetic field therapy, which you'll hear me refer to as PEMF therapy a lot, I'm going to talk more about the mitochondria, right? So that you have some understanding and background in that. So first of all, if you don't know what are the mitochondria are often referred to as the powerhouses of the cell. So they help turn the energy that we take in from food into energy that we can use. But they aren't just all about energy production in terms of how we see them impact the body. They are present in nearly all types of human cells, and they're really vital to our survival. And that's why there's just being more and more research about the mitochondria, what impacts them, and also what we can do to enhance them, especially from a nutrition perspective. So the signs of poor mitochondrial function are quite vast. You can have a body that's having a harder time dealing with stress, you can be fatigued, have poor memory, just loss of cognitive function, brain fog, hearing loss, fatty liver, kidney problems, infertility, vision problems, digestive issues, insulin resistance, muscle weakness, and cramps. And I would say that was just to name a few. Like I have been working more in my practice, like really focusing on cellular function and mitochondrial function. And I find that it links to a whole variety of symptoms in people. So we want to understand, why do the mitochondria start struggling, right? And I see clinically that it's a variety of things that stress the mitochondria. Viruses do, parasites do, heavy metals, medications, and ways that the body starts dealing with severe oxidative stress. One of those can be lack of oxygen at the cellular level. Poor sleep can cause high oxidative stress, especially poor eating habits causes oxidative stress, like high amounts of sugar really does cause that in the body. And as we're going to be talking about more, stress and the stress response damages mitochondria as well. So stress is such a broad thing, right? And so I just wanted to just define it a little bit here because we talk about it just so loosely and it impacts us in such a diversity of ways. But if we really want to think about it, it's a non-specific response of the body to any demand for a change. In short, it's a biologic response to stimulus, right? And to often things that are perceived by the body as a negative stimulus or overwhelming stimulus. And for sure, I'm at the office and the dogs are barking, so excuse me. I'm just going to make sure my door is a bit better closed, and I'll be back. Sorry about that. That should make it a little bit better. Less interruptions. I mean, yeah, one of the biggest issues with modern life and stress is that it's an ongoing stress, and so much of it is perceived stressors, like how are we perceive what we're experiencing in day-to-day life, and then how that creates these biological responses. So I'm going to go into a little bit more detail because it's a complicated response, and we're not going to go super dive into the biochemistry, but we have this thing called our autonomic nervous system, right? Which really refers to autonomous things that function on its own. And so our stress responses are mediated through the autonomic nervous system, and it's regulated by all these vastly integrated reflexes, go through the spinal, brainstem, spinal cord, our organs. And so if we want to think about all those autonomous functions, they are our breathing, our heart beating, our digestion, our blood pressure, a lot of our involuntary movements, and reflexive actions like coughing, sneezing, swallowing, and vomiting, right? And yeah, so as I said before, all things that to a degree we can consciously control, but many of them we can't at all. But as I was saying, that stress and that stress response, it impacts our bodies vastly, and it suppresses immune function. It impacts our cardiovascular health, right? Our heart health, our digestive system, right? You may have heard of the vagus nerve that connects the brain and the digestive tract, and thus, there can be digestive issues that throw off brain, contributing to anxiety and depression, but there also can be that mental, perception response of stress that then throws off the digestive tract. People can have stomach aches or diarrhea or poor malabsorption. Brain function is impacted by stress, and our hormonal balance is also impacted negatively by stress. And so just before I speak more to this slide, I mean, there has to be a multifaceted response to addressing stress in the body, and thus limiting the damaging effects on our mitochondria. And of course, especially if you're clients of mine, we're working on this constantly through decreased carbohydrate digestion, right? Having less sugars, having less grains, and providing the body with key B vitamins and things and minerals to help the body with its stress response. I definitely talk to clients about how can they reduce outside stressors. But there are some stressors that we just can't control, or we have to then focus more on our own physiological response to it. And there are tools such as restorative yoga and meditation, but I really want to share today about the benefits of PEMF therapy in that regard as well. So in this slide, this is a picture of a PEMF mat, right? And we have one in the office, and you call it your 30-minute power nap is one fun way to refer to it because of the restorative benefits it has after lying on it for 30 minutes. So PEMF therapy uses bursts of low-level electromagnetic radiation to heal damaged tissues and bone, to relieve injury-related pain, and to even stimulate organs. So it uses low frequencies that pass through the skin. They penetrate deep into muscle, bones, tendons, and even organs to activate our cellular energy, right? Activate those mitochondria and encourage all of our inherent natural repair mechanisms. So it's gaining in popularity as a non-invasive way to approach injuries, chronic pain, and even chronic conditions like depression and diabetes. For those of you who know more about the damaging effects of electromagnetic radiation, right, referred to EMFs, I just want to clarify here that this is very different than your high frequency cell phones, cell towers, computers, things like that that have the damaging EMFs. So PEMF therapy is a much lower frequency. The earth actually gives off an electromagnetic field frequency of 8 hertz. And PEMF therapy is down in that range, and you can do therapies right at that 8 hertz too. So it's about a term you can hear of is grounding, right? Grounding with the earth. Right, so how does it work? Well, you lie on it and you relax, and then it sends it releases those frequencies. And how does it work in terms of stress reaction? Well, it actually reduces the body's and the brain's reaction to stress. It helps the body eliminate excess neurotransmitters and hormones when you're in that fight or flight stress response. And it helps make the body more resilient too. So it defends our body cells and tissues against the physical changes that are induced by stress chemicals and hormones. And it provides healing to the tissues that have already become damaged from that response. After PEMF therapy, people's heart rate and blood pressure decreased. Their cardiovascular system is less reactive to stress hormones. And our relaxation part of the nervous system, which is called our parasympathetic part of the nervous system, is activated. So you might have heard of parasympathetic as your rest and digest, right? We want to be in a mode where the body's able to rest, able to repair, able to run digestive functions. Too many people are always in sympathetic mode, which is known as that fight or flight mode. And so when you're lying on the mat, it's stimulating the spine, it's sending off these low waves through the body, and that reduces our production of cortisol and other stress hormones. I was talking earlier about how it helps clear excess stress hormones from the body, and it does that by stimulating the kidneys. And it stimulates the brain, specifically the hypothalamus, which is a small gland inside our brain that makes our hormones and releases hormones. And so it helps mitigate the brain's response to stress. Resetting that whole axis that has the hypothalamus communicates with the thyroid, it communicates with the adrenals. That can create quite a negative feedback loop if there's high stress hormones, and so it helps to reset that. So there are a lot of benefits listed here to PEMF therapy. I am just touching on a little bit, and what's so cool about it is there's a lot of research about it. I mean, this is something that there are being used in clinics for such a diversity of health concerns. A lot of papers being written about it, but it helps to decrease pain. It can increase microcirculation within minutes of usage. It increases and enhances your uptake of nutrients. So that's one thing I think is so cool as someone who focuses on nutrition and so many people with damaged digestion, the fact that this is such a lovely additional therapy because it helps people's supplements be more effective. It helps the food choices that they're making be more effective. As we talked about a lot, it helps reduce stress in the body. It helps improve sleep patterns. That's the biggest thing that I have noticed after I do a session is that I sleep better. And the man who developed the particular mat that I have here in the office, I I've heard him speak extensively about it, and he was the one who initially educated me about it. He has his own personal mat, and does a session on it every night before he goes to bed. So it induces faster healing of soft tissue. It reduces inflammation and swelling. So it's great for post-injuries, for post-surgery. It helps accelerate nerve regeneration, right? If it's already been degenerating. Faster functional therapy, right? So again, they use it a lot for especially recovery from knee surgeries. Enhanced capillary formation, increased cellular energy levels, as we were talking about, boosting those mitochondria, and also by improved ability to rejuvenate the cells. Improves immune response, basically through decreasing stress and increasing cellular function. Oh, have decreased pain on there twice. Sorry about that. Oh gosh, sorry. I didn't catch this when I was reviewing this. These are listed twice. So yes, those are the main reasons why PEMF therapy can be a wonderful addition to what you're already doing to take care of yourself. And yeah, just a very cool tool. And so as I mentioned earlier, we have one in the office, and we offer that as a service to people who are current clients or people who are not clients. Anyone can come and purchase a standalone session or a group of sessions, and it's upstairs, it's private. You can just lie down, relax. We do the sessions for 30 minutes at a time. And yeah, I do recommend doing it more as a series, right? Some folks, they do one session and they notice a change. But like many things, it's the body benefits from ongoing treatment, right? We have our crazy busy lives. We're running around doing so many things. Doing a session allows this time to pause, to take a break, to allow the body to reset the mode that it's in. If you then just go back into your life, that one session is not going to do a lot to reset those patterns. But I find at least 6 sessions, it really does help to reset some innate patterns, and especially innate or current patterns of stress hormones and stress response. As I mentioned earlier, the man who developed the mat that we have in the office, he has one at home, and he recommends that people use it every day. I mean, he says he developed it initially to have support for family members who were dealing with diabetes and neuropathy because of that. And he found the most benefit when family members did it at least once a week. I mean, he worked in diabetes clinics with this tool, but he loves his, and he has it at home and does it as a regular therapy. But there are just many ways to integrate it. And I see I have a question coming through, so I'm going to look at that. Yeah, thank you, Paula, for asking about the cost. I realized as I was just starting to talk about that I don't have the numbers in front of me, and I apologize about that. I should have done that. And so we can communicate directly with you about that, but it's the front desk that has that information. I just don't remember off the top of my head, and I don't want to give any incorrect information. But for sure, it is. Yeah, sorry about that. Thank you. All right, any other questions coming up? Anyone's wondering about with this therapy, how it could work into what they do? If you do, please let me know. I'm going to stop the recording right now.